11 of Saint Lucia's 15 COVID-19 patients have recovered. That's the news from Chief Medical Officer Dr. Sharon Belmar George, who was once again at the pains to explain the difference between quarantine and isolation in the management of an epidemic. Basically, people are placed in quarantine when they are not currently sick, but have been or may have been exposed to a communicable disease. Isolation, on the other hand, is the complete separation from others of a person suffering from contagious or infectious disease. Isolated patients are infected, and quarantine patients appear healthy but may have been exposed to a contagious disease.
This quarantine period allows for monitoring of contacts who develop signs and symptoms over the incubation period of the particular disease. We use the designated quarantine facilities for persons who travel into Saint Lucia from areas of high risk and persons who were in contact with any positive cases who do not have signs and symptoms. There are certain cases where an assessment is done by the Ministry of Health and that individual may require home quarantine. One example is someone who is confined to the bed and is not able to function dependently. Isolation is used to separate known sick persons from those who have a communicable disease such as COVID-19 from others who are healthy. Isolation restricts the movement of sick persons to help stop the spread of infection.
A diagnostic test is the only way to confirm if someone is infected with COVID-19. However, people who exhibit symptoms of the respiratory disease and are suspected of contracting the novel coronavirus or the disease it causes, called coronavirus disease 2019, are also placed in isolation.
In Saint Lucia, our positive COVID-19 cases are kept in isolation. Isolation is also done for persons who have flu-like symptoms who were in contact with positive cases and also for patients who have not yet been confirmed as COVID-19 cases. These individuals are also kept in isolation until their results are received. So at any one point, the number of patients who are kept in isolation would be higher than the number of persons that we have as positive for COVID-19. We keep our positive COVID-19 cases in isolation. We also keep contacts who have symptoms in isolation, and we also keep persons who may have access care through the respiratory hospital and are awaiting their test results.
The Chief Medical Officer reminds Saint Lucians that the 10-hour curfew and cordon sanitaire are still in effect to restrict movement to slow the spread of COVID-19. Citizens are advised to stay at home and only venture out to purchase essentials or in case of medical emergencies. Videos have once again surfaced online and in the mainstream media of Saint Lucians from coast to coast, milling around their respective communities, engaging in social events from pickup sports to beach activities. Authorities are imploring Saint Lucians to stay at home to save lives.
Remain at home, leaving only for food or medical purposes. Avoid masquerade events and social gatherings. Practice physical distancing and good personal hygiene. The public is also advised against going to public places with flu-like symptoms, including fever, coughing, and sneezing. When visiting the supermarkets or public places, refrain from touching items unless you intend to purchase them. Essential service workers and the elderly are granted time for grocery shopping to facilitate their timely return to their posts and homes respectively. The public is asked to exhibit patience while these segments of our population are being served. Although hardware stores are open in an effort to facilitate household emergencies and increase water storage capacity, the public is reminded that we are still on national scale down.
Public health officials indicate that the lockdown is far from over as the island attempts to avoid an explosion of cases on the epidemic curve. Therefore, Saint Lucians should continue to, among other measures, wear face masks in public, practice social distancing and regular hand washing with soap and water or alcohol-based hand sanitizer where soap and water is not available. Colby DeVoe, HTS News Force.